Hey YouTube friends, do you suffer from headaches or migraines? If you're looking for natural remedies for that, I've got 9 of them for you today. Real quick, a little bit about me. My name is Dr. David Midoff. I'm a specialist physical therapist over at El Paso Manual Physical Therapy, and I've been helping out people with headaches and migraines for years now. I often see people that get this pounding pressure on the front of their forehead right here. They get radiation from the back of the head along the side by the temple. Sometimes it's tenderness all over the scalp, or pounding pressure and tightness and pain at the back of the head. And then every now and then you get the retroorbital headache. It's the pain behind the eye, and you just can't quite get in there to touch it, but it hurts and it just aches and throbs behind the eye. These types of headaches, we are experts at helping people out. They often are taking pain medications regularly. They may go see neurologists to get specialized pain medications. Sometimes they get injections for it. Oftentimes they're missing work, or they're just not able to function daily and be their normal selves because of this darn headache and migraine problem. If you've got some combination of those issues that I just described, then you're going to want to hear these 9 remedies that you can try at home right now so that you can begin to calm down your headache or migraine problem. Number 1, ice and heat. And I put these 2 together because one may work for you and one may not. And a third option is neither may work for you. It's just an option to try out. So using ice on your head, like grab a bag of ice, in a Ziploc bag, or put a towel around it. You find the best method for you. There's ice packs that are out there that are gel, and they can conform to your head or body part wherever you want to use it. You can buy those at the grocery store or warehouse stores as well. And just put that wherever you feel like your headache is bothering you. Now, if you've got a lot of sensitivity to the cold, because that does happen to some people with headaches, then an alternative would be to try heat out. If the ice just doesn't work out for you and you've tried it out, great, scratch that off the list. Now go get heat. So sometimes the same ice packs that you purchase at the store can be heated up in the microwave or some other method. A hot water bottle works really well as well. Those are a little older, but you can use they have rice packs out there that you can heat up in the microwave and put it on over you. Another option is a towel. Just get a small hand towel, dampen it in the sink with some water, and microwave it for 30 seconds, and it gets nice and steamy. So a steam towel, and just put that over your head or wherever you feel like it bothers you. And that's an easy way to get heat onto your head. Now, if you tried both of those options and they're not really working for you, or they don't work consistently for you, then you just may not be a heat or ice person, and I would just scratch it off the list. But oftentimes, ice or heat may be effective enough to bring the headache or migraine pain down just a bit, so that you can avoid taking a pain medication, or maybe even avoid going to the doctor, and keep it under control so that you can be a little nicer with people around you. Number 2, drink water. Oftentimes people don't realize how much water they're not drinking. And especially if you've got a desk job and you're busy at work, and you just are busy with your work, and you don't really feel thirsty until the end of the day, it's already kind of late by then. You've already become dehydrated. So what you can begin to do moving forward is make sure to get plenty of water in. Generally, 80 ounces or more is good. There's all kinds of measurements out there. What I've found is that if you get about 5 water bottles ranging in size from 16 ounces to 20 ounces or more, if you make it a point to drink all 5 of those water bottles every day, you're definitely going to be hydrated. You'll be going to the bathroom a bit more. That's okay though. If your headaches are going away, it's a much better life experience. Your quality of life will improve tremendously, and you'll be surprised what difference this could make in your headache and migraine problem. Number 3, reduce screen time. As I said at the beginning of this video, we are surrounded by screens. They live in our pockets. We're attached to screens almost, and it does something to your head. There's all these research studies that have been coming out lately about the different shades of light that are coming off of like mobile devices, phone screens, or even television screens, and how they can affect our eyes and our brains that are right behind our eyes. And with that type of light coming in, it can set off headaches. We've seen trends where kids that are on computers more, using mobile devices more, tend to get more headaches and migraines. And part of it is postural as well, which we'll get into. But if you can reduce your screen time, if it's possible for you to print out that document that you're working on and handwrite something on it, or read a book instead of reading something on a mobile device or on a Kindle or something like that, don't watch as much TV as you've been watching. Find alternative methods to using the screen. Literally having cutoff times where you say, I'm only going to be on my phone for this one task, and then that's it. I'm going to stay off of social media, which might suck you in, and get on to doing different things besides using the screen. If you feel like you're using the screen too much or screens around you too much, you're probably right, and you need to start cutting back on that because of the light that enters your eyes. It could be setting off those headaches and migraines. And just another side tip about that, if you have to use screens, look at dimming your screen. See what amount of brightness you can bring it down to and still see what you need to see and do what you need to do. And then also there are more settings coming out of computers that control the types of light so that you can get rid of the blue light, which is thought to contribute to headache problems. Number 4, posture. Related to the screen time, consider your posture whenever you're at a desk looking at a computer or using the mobile device or watching television. If you're slouched over, head is sticking out, particularly this part where your chin is sticking out and you're bent through your neck forward like that, chances are your posture is not good and you need to find a way to sit up more or recline back onto something with your head, ideally resting on a pillow or some sort of headrest. Recliners are excellent for this. If you can lean back and the recliner has a head support, that's probably going to be the most comfortable option for you. If you're at work using a computer, ideally if you had a desk chair that had head support, that would be beneficial for you as well. Now, if you don't have either of those options available to you, it's okay. You can still improve your posture. One of the easy things that you can do to improve your posture at a desk or any other time that you're using the computer screen is to get rid of this chin going out forward by making a baby double chin. Let me just take you through that real quick. If you make a max double chin, it's okay, nobody's looking, just you and me. Do this all the way, make a big double chin, and what you should feel are those muscles behind your throat tightening up. Kind of, this is my throat right here, right behind are those muscles, not on the sides, right there. Those are the deep neck flexors, and they help to get better posture through your neck bones. Now, back off on going so hard and do it lightly, just to the point where you feel like they're turning on. So for me, it's right there. I can feel them just barely wanting to fire, and that is better neck posture for me. So now if I can work at the computer like this or work on my phone like that rather than do this, it's going to be a much better situation for my neck joints to all be aligned properly and take pressure off nerves that can contribute to those headache and migraine problems. Number 5, exercise. If you aren't doing some sort of regular exercise at least a few times a week, whether it's going for a walk or maybe you go to the gym or you partake in some sport or physical activity with your family or kids or whoever it may be, it is a big deal. Getting that regular motion where you sweat, where you work up a little bit of a sweat, you move quite a bit, and it's consistent over time. And when you do it for 15 minutes or 20 or 30 or more, then it is likely a big contributing factor to your headache and migraine problem. The fact of the matter is that when we move our arms and legs, there's nerves that travel through our arms and legs that move along with our arms and legs. And those nerves are connected to our neck and our brain. And if we're not getting adequate movement throughout our entire body, it doesn't get the mobility that it needs, and you can begin to get mobility issues within your nervous system. I've seen it time and time again. Once people get on some sort of regular exercise program, their headaches and migraines diminish and eventually go away if that's the biggest factor contributing to their headache and migraine problem. Number 6, a shrugging exercise. So shrugging is a huge deal for taking pressure off the neck joints. And the neck joints are so critical to have good mobility and for them to not be stuck so that they don't pinch the nerves that go up and innervate the head. So an easy, quick thing you could do at your desk, or if you are taking long drives and you're in this posture a little too much, is just tuck that chin in, do that baby chin tuck, and then shrug and go as high as you can and hold it there for 10, 20, 30 seconds if you can. And what you should feel is these muscles working. And now you need to dig down deep and go as high as you can without letting your chin jet out like that. Make sure you keep it in. And you might actually feel some pops and clicks happen within your shoulders, sometimes even in the neck. As long as it doesn't hurt, that's okay. You're freeing up a stuck joint that might have been contributing to your headache or migraine problem. So doing that shrug exercise throughout the day can be very beneficial for you to reduce the discomfort and avoid taking a pain medication. Number 7, don't stretch. So many people come in to our clinic here that have had headaches and migraines, and they've been stretching. They've been grabbing their head and pulling it over, looking down and pulling their head over like this, attempting to stretch out their neck joints and neck muscles. And oftentimes, sadly, they've been told to do this by other medical professionals who just don't quite have a good handle on how to treat headaches and migraines. It tends to overstretch muscles that are already stretched, and it also tends to overstretch nerves that are aggravated. So even though it may feel good in the moment to get that stretch in, long term, it keeps the headache and migraine problem there way longer than it should be. Number 8, get sleep. If you're not getting enough sleep, whatever that is for you, because it's not a 8 hours, one size fits all situation. I can tell you for me, I'm more of a 6 to 7 hour a night person. But if you're not getting enough sleep consistently, then work on getting enough sleep. Make sure you get to bed on time or at a reasonable time for you, and try to plan so that you have enough time before you wake up so that you slept enough. If you don't get enough rest, your nervous system, your nerves, which includes your brain and all the nerves that come off of it that feed into the headache problems, are tired. And if they just are getting too much stimulus, like from lights, from computer screens, from people talking to you, from sunlight coming outside, from things, noises that are around you, all that can overstimulate a tired nervous system and contribute to a migraine and headache problem. So make sure that you track your sleep and get enough of it. Number 9, see an expert. By far, this is I think the best recommendation, because if you can see somebody who's a specialist in handling headache and migraine problems, you can speed this process up and get much better control of it. All too often, whenever we get people with headaches and migraines here in the clinic, they've been dealing with them for years. And if we had talked to them within a month or two after they began to have more severe headache and migraine problems, they would have been done with it and saved themselves all those years of trouble and heartache and taking ibuprofen and seeing doctors and getting injections and seeing specialists. I've even had patients that go see dentists because they think that it's related to their teeth problem and get their teeth pulled out as recommended by a dentist. And then we get them here in the clinic and do some more specific guided strategic treatments, and they clear up. And then they have the realization that I could have kept my molar. I could have avoided all those years. I could have had a better relationship with my spouse and family had I just gotten some expert help sooner. It's a no-brainer when you look at it that way. So I strongly encourage you to go get some expert help so that you can get really focused on making sure this problem is not something that's just pestering you throughout the day and ruining relationships and your work quality and your life quality. Well, YouTube friends, if you thought that this was helpful for you, please give us a like right here and then hit the subscribe button over there so that you can get notified whenever we release cool, helpful content that might help you be healthier in your life. And please share this as well with anybody that you think needs to hear it. Thanks so much and have a great day. Bye-bye.